All right. Hi, students. Welcome back to middle adulthood. As you guys know, it's been noted many times, right? There's no clear age divisions that mark the end of one stage or the beginning of another. But basically, when we're talking about middle adulthood, we're talking about folks who are in their 40s and 50s. All right? All right, so open up your slides and bring yourself to the second slide, which is titled Physical Development Changes in Sensory Abilities in Middle Adulthood. All right, so sensory functioning. We're starting to see changes here in our 40s and 50s, and basically that change means a gradual decline in our senses. The most apparent one is our vision. Our vision declines the most, and it's most evident, as you guys would probably observe, in reading, right? A lot of more people are just using readers just so they can read their newspapers or their books. So what we're seeing is that lenses in our eyes are becoming less flexible, and we're also having our rods and our cones in our eyes are diminishing. And so there's this gradual decline in our vision. We also see hearing declines for about 15%, a little less, of adults in this age from developed countries. This is especially true for high-pitched sounds, not being able to hear those. And again, we're having parts of our ear, the cilia, is thinning out, and we're having less flexibility in our inner ear. Go back to Psych 101 and review how that all worked. But we also know that environment plays a role with hearing. So again, back to 101, and I always stress this in my classes, is our environment, what we're exposed to. Are we shooting guns without protecting our ears? Are we going to lots of concerts without wearing earplugs? There's lots of environmental and lifestyle choices that are going to later on impact your hearing as you're in your 40s and your 50s. So it's kind of interesting thinking about different implications, like, we know that there's a physical change with our vision, and a lot of folks are having vision changes. Should we be requiring people to be taking eye tests when they're 50? So these are some of the fun kind of questions you can start to ask yourself when we're looking at this research. Let's go to slide 3. Most important physical changes that's happening during this time, during midlife, occurs with the reproductive systems for males and females. First, I want to focus on females, but basically you can see here changes in reproductive systems. We're on slide 3, culminates basically with the end of monthly ovulation and the end of menstruation. So this is what's called menopause. So it starts with periomenopause, as you can see on this chart here, which tends to be a lot of those symptoms that people associate with menopause, like the hot flashes and the headaches and the dizziness and the mood changes and that sort of stuff. So you can see the age as we go. The average age in developed countries is 51. To be in menopause now, that is a whole year of having ceased menstruation. So the timing, very variable. It's influenced by our genetics. We do see a really big variation. So it can go from in our 40s to our through our 50s. We also see, interestingly, the culture can impact the symptoms that we record or catalog or talk about, but we don't know the difference why. Culturally, it's interesting when we look at Japanese women, they report fewer symptoms of menopause, and we're looking at that and we're seeing that we believe it's partially in their diets because of a high soybean product intake. We think that plays a role at estrogen, which impacts the symptoms and sort of trajectory of menopause. Of course, we have hormone replacement therapy for women to help with those severe symptoms if there's major complications. But there's risks with hormone replacement therapy, but it is out there. But how do women typically feel about this? Typically, when we survey women, the majority of women are welcoming this change in life, welcoming and enjoying, actually, the change through menopause. So that's kind of interesting because I think a lot of times people think it's so negative, but most women actually are welcoming when we look at the research. As far as men, reproductive changes in men, let's see here. So men, they have lower testosterone levels, so their hormones are changing as well. It does impact the sperm quantity and quality and decreases both of those. We think maybe there's an evolutionary reason why men don't actually go through what we would say male menopause, and why that's different. But both reproductive systems, fertility does decline during this time. Slide 4. Overall health. So we talked about the changes in sensory system, changes in our reproductive systems. Overall, look at this chart here. You can see an age from 20 to 100, and you can see the differentiation on income. But for everybody, any income bracket here, overall health declines in middle adulthood across all countries, across all incomes. Though we do see a difference. Health scores decline to a greater degree across countries at all income levels, of course, but a greater degree in the low and lower middle income. So the high income, upper middle incomes do decline, but not as drastically. So overall takeaway is overall health does decline for everybody. Slide 5, influences on this. So influences on midlife health and then later. So there's some really interesting studies, like a meta-analysis that was done looking at, okay, what are the characteristics of someone in midlife that's going to predict what their health is going to be like in old age? So say 25, 30 years later. So if I'm querying a 40-year-old, what is their health going to be like when they're 70? They actually found some really interesting characteristics that are going to that were identifying and predicting either negative health outcomes or positive health outcomes. So what predicts negative health outcomes? We see if you are smoking cigarettes in midlife, this is going to predict negative health outcomes. Being overweight and misusing or abusing alcohol predicts negative health. So smoking, drinking, being overweight. These are predicting negative health outcomes later in life. On the flip side, what's predicting health? Positive health outcomes. So we actually see education, the number of years, the more years of education one has, the more we can predict a better positive health outcome for one. Marriage stability, if you are in a stable marriage, that also helps predict, which is really interesting. And then this other ones I think are kind of interesting. Having a attitude of forgiving, being able to forgive, and being social, so being connected to others. So having a forgiving attitude, being social, or having high sociability, that's how they called it in the study, predicts positive health. Pretty cool. So education was a stronger indicator or predictive value over income, but they were both predictive for this meta-analysis study. So we do see what's going on in midlife is going to impact you, kind of obvious, right, in our later age, but we can actually narrow down those characteristics. All right, last slide of this, I think, yes, last slide for health here. So, all right, so yeah, things are declining, our senses are declining, overall health is declining now, but really most people generally are in good health through middle adulthood in general, okay? If they have adequate nutrition, if they have access to modern healthcare, these are huge indicators that play a role. It's nevertheless, of course, there are health risks and health problems in middle adulthood, including things like sleep, osteoporosis, cancer, coronary heart disease. So sleep problems are very common after age 40, and it tends to occur with other types of problems. The complaints about not getting enough sleep, or a very common complaint is waking up a lot during the middle of the night. Osteoporosis is something we have to watch out for here. Bones are becoming more thin and brittle because we're having a rapid calcium depletion during this age. And this is actually impacted by women's loss of estrogen. Estrogen loss increases the chances of osteoporosis. So we have to watch that. We have to watch diet and exercise. Basically, if we have a lifestyle that is including a good diet and good exercise, that can protect us from osteoporosis. So that's a good thing. Cancer, leading cause of death for folks in this age, leading cause of death for adults 45 to 64. Prostate and breast cancer are the most common. The best thing we can do is early detection. So early detection is the most important thing we can do. Again, that's access to healthcare, why that's so important, early detection. So healthy diet, of course, avoiding risk factors, getting your mammograms, and then we have plethora of treatment for cancer. Coronary heart disease. All right, second most common cause of death among this midlife age. Again, risk factors, high-fat diet, smoking, lack of activity, not moving, stress. These are our factors. So on the flip side, we have protective factors. The protective factors are exercising every day, moving around, having a healthy weight, even maybe taking the aspirin a day. Talk to your doctor about that one. All right, so I'm going to wrap up health, and we're going to go into cognitive, and I'll be back.